Dear Jennifer, welcome.
Thank you.
First of all, thank you very much for accepting the interview and consultation our circle. Thanks a lot. Thank you so much for taking the time between your work. Thanks a lot again. Thank you.
It's my pleasure.
Firstly, could you tell us a lot about you, what you interest study, or what about you?
Sure. So I'm Jennifer Grisham, and I am a full professor at the University of Kentucky in Lexington, Kentucky. And I teach in the interdisciplinary early childhood education program. And we train teachers to work with children with and without disabilities who are birth to 6 years of age. I'm also the faculty director of an early childhood laboratory school on the campus of the University of Kentucky, where we provide full day services to children that are birth to 5 years old with and without disabilities. And we also serve as a research site for our campus. And we also provide service and training to people who want to go into education or psychology or nursing or any other field where they are going to work with children. I do research in the areas of authentic assessment. I am the developer and co-author of an assessment instrument that assesses children that are birthed to age 6. And it covers 8 developmental and content areas. And I have done field tests of that assessment tool all across the United States and also in several other countries.
Oh, your experiments is very effective and amazing in early years. Thanks a lot. We use your research and studies a lot. And the other question I want to ask you, considering your studies in early childhood, what are your research interests?
So presently, I am doing research in authentic assessment. So looking at the validity of the assessment tool that I'm using. The other area that I'm really interested in is something that's called multi-tiered system of support. And that is a model for trying to how to support children that are functioning at different developmental levels and trying to support them so that they can all learn within the same environment. And so I've written some books and I've written papers about that and have also conducted research in that area. I'm also very interested in what we call embedded instruction. And this is where we look at children's individual learning goals and then we embed their interventions or strategies into the classroom so that children can learn alongside of one another. I'm also very interested in coaching teachers and families. And so I have been involved in research where we have used web-based coaching to support teachers who are working with children with disabilities and also working with families so that they can implement interventions to support their children's development.
And another question is, what is development assessment in early childhood and why is it important?
Yeah, so with young children, there are a variety of different reasons that we do assessment with them. Sometimes we screen children and we just get a snapshot of just looking at them to see whether or not we have concerns about their development. Sometimes we evaluate children to see if they need special support so that they can go to school. But the primary area of assessment that I am interested in is assessment that is going to help teachers and help families understand their children, how to develop their curriculum, how to design activities, and how to support their child's development. At this early age, development is interrelated. So children, a child's cognitive development will impact their social communication development. If a child has a delay in social emotional development, that's going to impact their social communication development. And so completing a comprehensive assessment on a child gives us a holistic picture of who that child is, so that we know then how to focus our instruction, how we will know how to motivate that child's learning, how we will ensure that that child is prepared when they get ready to go to school. And so I am really interested in assessments that are useful to teachers and to families, so that we can provide a great deal of support to those children in classrooms and in their homes.
Yeah, you said assessment evaluation is important for children learning and development periods. Yes,
Absolutely. Absolutely.
yes.
Especially at this.
Yes, I want to learn what techniques is important.
Oh, yes. Okay.
Yes.
Yes. Okay. Yeah. So, young children, when we think about assessment or evaluation with older children, we sometimes will, give the child a piece of paper and we ask them to complete something, or we ask them to do something like we have done it. And that's referred to as direct testing. And young children, they do not function that way. They sometimes will, if a parent asks a child to do something, they sometimes will not do it. It depends on, their mood. It depends on if they know the people that are there. So the type of assessment that I promote is called authentic assessment. And authentic assessment is where we are gathering information about children in the places that they spend time, when they are playing, when they are out on the playground, when they are in the classroom, or when they are at home. So we use observation as the primary technique for how to gather information and assess young children. The other way that I think is very important for us to do assessment and evaluation is to talk to the people that know the child well. And so to talk to the family, or to talk to other caregivers who have known the child, who spend the most amount of time with the child. And through observation and interview, I think that we get the most accurate information about a child's development. And we call that authentic assessment.
I want to ask one question more. What should prefer the parents? How can observe their children development? What can they do?
So, I think that parents are constantly observing their children. I think that they're watching them and play all of the time. I think that it's our responsibility as professionals in early childhood to teach families about development. And that is the reason why that a good developmental assessment is so important. If we are doing that assessment alongside of the families, then families begin to learn the sequences of development that children grow and learn in. And so as they learn about development, then they can, become, they can begin to collect some information about how their child is doing. And they can also know what to expect next in their child's development. Families are oftentimes the first people to suspect that maybe the child's not developing correctly. And so we need to really listen to the families, and families need to feel empowered to articulate what it is that they know about their children and share that with the professionals that they're working with. And so developmental assessment can support family in learning about it. And when there are about that development, then it gives them a look at to know where there might be a gap in their child's development.
They need support.
Yes, and there needs to be a partnership between the family and the professionals, so that they can work alongside each other. I mean, professionals in early childhood have learned about development, and we understand how children grow and learn. And I think it's our responsibility to support families to understand that information as well.
Thank you for the nice interview. I hope to see you again. Thank you.
Yes, thank you.